I'm going to go ahead and start since we're late. And if anybody else joins, that will be great. And we're going to end up having this recorded so they can always watch the recording later. But I just thank you, Tani and Lauren, for um, joining us. And of course, our esteemed Courtney for doing this presentation, which I'm going to be paying attention to because I need to know more about that program. I'm going to make a few announcements, which you may have already heard of. We're going to have a fundraising, our annual scholarship fundraiser in November 8th. We're going to be honoring Dorothy Colby, and there will be a flyer with more details coming in the June newsletter. So please do look for that. And of course, our biennial conference is in the planning at this point for September 2025. And we are hard at work on the theme, and we'll put it out there for speakers probably in the next couple of months. But please do keep in mind that put it on your calendars for September 11 and 12, 2025. So with that out of the way, today's general membership meeting is going to be hosted, or our featured speaker is going to be Courtney DiBaggio, on the board at HPGS, and we're very excited that she joined us. As you may know, since Tani, you know her, she's a Molokai girl, a Native Hawaiian registered nurse at the Molokai Department of Health Public Health Nursing Program, and a clinical lab instructor for the CNA class at UH Maui, Maui Molokai campus. She has 20 years of nursing experience helping those in need, and is currently focused on finding options and providing care for kupuna on Molokai and helping to find ways to grow the Molokai healthcare workforce. Courtney is going to be providing a glimpse today of the work of the public health nursing program and the role of public health nurses in the community, vision, mission, and the values of the Department of Health Public Health nursing branch is a major part of the work that she does. So with all that, Courtney, please take it away.
Well, mahalo for allowing me to do a presentation. So like Laurie said, I am a registered nurse. I was born and raised on the island of Molokai, and we like to make connections. So we like to tell stories. So it's much more interesting when we talk to people and we get to tell our story and to tell people who we are, where we come from, so that we can make that connection. So I was born and raised here in Molokai. In order for me to obtain my degree in nursing, I needed to relocate off island to seek that degree. I've been off island, went to Hilo, went to Maui, and I earned my associate's degree in Maui, then my bachelor's with University of Hawaii, University of Phoenix. And I was working for Hui no Keolopono at that time, which is Maui Native Hawaiian healthcare system. I love nursing, and I also fell in love with the idea of community nursing. So hence, when the opportunity posed to work here on island as a public health nurse, I jumped to it. So you're gonna come on this Huaka'i journey with me, and we're going to kind of go over what is a public health nurse. I'm gonna share my screen, and when they asked if I could do a presentation and asked if I could share for about 45 minutes, I said that you guys gotta kind of help me tone it down because I might share more and go over. So we're hoping that I can stick to it. I have a script so that I can focus. So I'm going to be presenting full screen. All right, let me move you guys out of the way. All right, okay. So we're gonna go over what's a public health nurse. And so today's objective is to to provide a better understanding what public health nursing is, public health in Hawaii, our mission and vision of the Department of Health Public Health Nursing, the different type of nursing, and our presence in the community that we have. My hopes is that by the end of today, you would be immersed and well knowledgeable in public health nursing. Well, that's the hopes. So let's go on this journey together. So according to the Association of Public Health Nurses, the public health nursing is the practice of promoting and protecting the health of population using knowledge from nursing, social, and public health sciences. So basically, we are nurses that use all of these. It's like, this is a bunch of words, but this is the real definition that we'd like to share. Moving on. So I'd like to give you a brief rundown about public health nursing or public health in Hawaii in general. So pre-Western contact, we had some kind of public health in place, and it was through La'aulapa'au practitioners, pre-Western contact. As we see, our ali'i King Kamehameha III, Kauikeaoli, had established the first board of health in Hawaii. The reason it was established because there was during this time, the smallpox and leprosy had significantly increased. So it was basically communicable diseases that came to our shores. And so that's why he started and actually initiated the Board of Health. During that time, or around that time, in 1859, Kamehameha IV and Queen Emma allocated their own monies to create the Queen's Hospital as a response to the decline in the Native Hawaiian population due to the communicable diseases. So, some form of public health was already established in Hawaii at that time. In 1883, the first Lunalilo home was completed. King Lunalilo Trust website states that the purpose of the trust was to build a home to accommodate the poor, destitute, and infirm people of Hawaiian and Aboriginal blood or extraction, with preference given to older people. So our ali'i already had seen what was going on around that time and felt that things needed to be done to care for the people. That's public health. In 1896, Palamo Settlement was established. So as you may all be aware of, like, Palamo Settlement was established after the bubonic plague, when they tried to set the Chinatown fire to combat the outbreak, but in turn it burned the whole place down. And so now all these people were left with needing services, and that's how Palamo Settlement was established. In 1906, through Palamo Settlement, the first public health visiting nurses program was established. And in 1919, Mabel Leilani Smith, who is pictured here, became the first head nurse of Palamo Settlement and had later become our first director of public health nursing services for the territory of Hawaii. So I am proud because I am of Native Hawaiian ancestry, and just to know that we had in our culture the tendency to provide and to care for other people, and it continued throughout this day until it was known out in the world with public health. So I'm proud. So that's why I like to share it. So moving on to our next slide. I'd like to share the vision and the mission of our Department of Health Public Health Nursing branch. So our mission, through excellence in public health nursing practice, will empower communities to support a healthier, safer, and higher quality of life for all. That is our mission. We want everybody to have quality of life, not just to be able to serve them and help them and make sure that they get what they need, but we want them to actually have quality and safe life for all. The vision is healthy, empowered communities for a better future. And our values is humanity, empathy, aloha, respect, and trustworthiness. That is what we strive for every day when we go out and help people as individuals or the community at large. Now, so what sets us apart is so basically what's different between us and the nurses in the clinics, the nurses in the hospitals? Before I continue, a lot of what we do as public health nurses is we use what we have to create programs or new things or services for our people that we reach out to. So the picture that I used was the lauhala. So with this lauhala plant, you can use the fruit to make lei. They use fruit as a way to brush strokes. You use the leaves to make hats. You use the leaves to make mats. Because you use everything that is on this lauhala tree. So you basically use whatever you have around to make beautiful things with. And we like to think that as public health nurses, we use whatever we have around to help the people that we help and to use whatever resources we can to get them what they need. So what's the difference? So it's time to break it down. So clinical nursing, it's the same, but it's different nursing. So nursing is focused on treating the problem at hand. So providing suction, IV fluids, and antibiotics with a child with pertussis. That's what a clinical nurse would do in a hospital. As on the other hand, as a public health nurse, we administer vaccinations for children for preventable communicable diseases such as pertussis. So we want to nip it in the bud before we even get to the hospital. Clinical nursing, you're administering oxygen, caring for someone in respiratory isolation. In public health nurses, we treat active TB. We do testing, we treat contacts and to prevent the spread of TB. So we're looking at the bigger picture now. Clinical nursing, caring for the elderly with a broken hip in the hospital. We at public health nurses, we do case management. We link them to resources before so that we can provide the support they need so that they don't end up in a hospital with a broken hip. Clinical nurses, they care for burns, dressing changes. We go door to door, do outreach education resources so that we can keep our community safe, teach our parents to make sure that they hide the matches, they don't expose the matches so that they won't create a fire, children won't play with fire and have this disaster happen. So instead of treating it when it's finished, we try to do the preventative side. So clinical nursing involves pathophysiology and pharmacology. With public health nursing, we also continue to do that, but we also collaborate and communicate and provide advocacy for our people that we serve. Okay, so I love this quote. As a nurse, we have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. And this is so true. I chose the picture of this kalo patch because just like the kalo, it's healthy. And with kalo, it's like one big ohana. If a person can thrive, then a community can thrive also. So that's why I chose that picture. And then let's continue on with our huaka'i with public health nursing. I like to tell stories, so we're gonna just bear with me. Just bear with me. All right, so as a nurse, I have been blessed to work with individuals, families, and the community. The best part about being a nurse is that, we get to help people find solution. In fact, we try to look for preventative ways. So one of the National Academies of Science, Engineering, and Medicine, they came out with a report about health equity and how to achieve health equity. And the key areas were valuing community and valuing public health nursing. So basically, in order to achieve health equity, we got to focus on the upstream, and that's where public health nursing comes into play. We look at the bigger picture. Okay, if we have 20 diabetics that are being admitted to the hospital, why are there so much diabetics? How can we change the mindset of the people to be better and take care of themselves so they're not ending up in the hospital? So that's where we come into play in the whole scheme of things. I love this cartoon. So this cartoon is actually like a reporter. There's a stream, they're downstream, and all these people are floating downstream. They're in the river. So people thought, okay, no, we're gonna have these lifeguards on the shore, and then we're gonna build a hospital right next to the shore so that when people come downstream, we can pull them up. And I love what this reporter says. So, but why are they in the river in the first place? That's where public health nursing again steps in. This one you can't see. So this cartoon, I love this cartoon too. So we need to stop just pulling people out of the river. Some of us need to go upstream and find out why they're falling in. And that's again, that's what we strive to do. So our work, taking action, going to the upstream to find out what's going on. Let's see. We need to figure out why do we have people in the places that we're at? Why are we having so much kupunas needing help? How can we help make changes so that they don't need help? Those are some of the things that we do. So continuing on this workout, you're joining with me about explaining what public health nursing does. You'll learn more about public health nurses of Maui Nui Akama. So basically our Maui County. So Maui County encompasses Maui, Molokai, and Lanai. Although I'm focusing on Maui County public health nurses, the public health nurses statewide provide the same services. However, each section will provide the services to meet the needs of their communities differently. It'll look different. The execution will not look the same at each section. But the only reason why I'm focusing on Maui County is because I have permission from Maui County staff to be like, yeah, let's do this. I'm like, okay, let's do this. So, as a public health nurse, and this is statewide, we are nursing consultants for the schools from preschools to high schools. We work with the preschools to address any concerns and provide consultation and provide education to the staff, Kiki, and the parents of the preschool. So on the top picture, this is our colleague, Sierra Iguya on Lanai, doing a presentation at a preschool. My fellow public health nurse, Cassie Babayan, she actually helped to provide a statewide presentation working with Punana Leo for each preschool to provide a presentation about um, emergency preparedness. So we do still do statewide things, but it just looks different. If students need medications to be administered and stored in the school setting, the public health nurse will meet with the student and their parent, legal guardians, and family and create a nursing consultation and emergency action plan in case the student has an emergency event in the school. So on Oahu, a lot of our public health nurses um, work really hard with providing these health consultations and emergency action plans for all the schools that are on Oahu. We also do it on the neighbor islands, but because Oahu has so many schools and from preschools to high schools, like a lot of their time is focused on that. We also statewide we focus on vulnerable populations. So one of the vulnerable populations is our infants with special health needs. We receive referrals from Kapiolani Medical Center for patients that are being discharged to home to follow up with child assessments to ensure baby is thriving, checking in with families to ensure things such as if they're able to if they're capable and knowledgeable about feeding their child in the home now, because now it's different. They can learn everything within the hospital setting, but once they come home, it's a whole new different story. Now you get, now you have other children running around. You don't have all the medical equipment that was at the source that you were at. Now you just kind of dealing with everything that is at home, and you need to kind of adjust to that. So we go in and we help the parents, support them in that way. Another vulnerable population, and which is close to my heart, is we follow with kupuna. So each section is different on how they work with the kupuna, but here at Maui County, we provide case management for our kupuna that gets referred. The community doctors, doctors' offices, sometimes APS will make a referral for a kupuna needing help with just doing spot checks to make sure that they're okay because they live alone, or they need help with filling up their medication pill boxes. They need help just to make sure that they're able to get to their doctor's visit. It's really a case by case basis. Our referrals are screened. So we do not go out to every single case or referral that gets referred. If there are other programs and resources in the community that can provide the services for kupuna that they need, then the kupuna will be referred to those programs first. Later on throughout our Huaka'i journey, during this presentation, I will talk a little bit more about how we specifically provide services for kupuna on Molokai. Another priority area that we focus on is communicable disease control. So as you can see, this was the time of when COVID was out and about fresh. This was in 2020 and 2021. We provide vaccinations during outbreaks and work directly with the Department of Health Immunization Branch and the Disease Investigation Branch. So during COVID, the Maui Public Health Nurses set the first drive-through COVID testing on Maui and drive-through COVID vaccinations. On Molokai, we were the first to provide mobile COVID vaccinations in January 2021. For us here in Molokai, our biggest concern was the spread of COVID. We have one hospital. If people were to contract COVID and needed to be shipped out, they would have to wait for opening at Queens, which was already at full capacity with the people on Oahu. So we decided instead of waiting for people to come to us, we'll go to them. So in the middle picture, this is when they were doing COVID testing. And on the lower picture, this was actually here in Molokai. We went on the east end of our island and provided the COVID vaccinations at a store in the parking lot. And so this is, I think I was giving my spiel about the effects of COVID and during their 15-minute waiting period. So we went to the people, and that's what I love about public health nursing, that we can actually go out and provide the services to the people and meet them where they're at. So to continue on, we do have, let's see. So with this picture, this is us trying to do emergency preparedness and outreach, retail outreach. So here we provide our community with information about emergency preparedness. Above is a community health fair that was focused for Keiki, which we also focus on. This was put together by our coworker, Alanai Sierra. And this was the first Keiki Fest that she was the lead in organizing it. This picture right here is the response after the Lahaina fire. This person right here is our supervisor, and this is the National Guard. So our supervisor took the lead with trying to get everybody together in one place so that services could be provided, because when after the Lahaina fire, like everybody wanted to help, but there's so much people going in to want to help, and that was awesome that a lot of people and providers wanted to help, but there was also a disconnect because there's so much people going in, but there was so much people not being reached at the same time because there was no protocol or a center where people could check in, like this is where we're going, this is who we saw. So she was very instrumental about trying to get the services that the people of Lahaina needed. We're gonna go on to going on through this Huaka'i. So this, I love quotes, and I'm gonna share them with you. So he a'ali'i kumakani maiau, a'ohe makani nana e kulai. So I am a wind-resisting a'ali'i plant. No gust can push me down. So no matter how strong the wind is, this a'ali'i still remains. So sometimes in working as a public health nurse, sometimes our efforts may get pushed back or sometimes it gets overlooked, but we still remain vigilant to working towards solutions and finding the, you know, and meeting the needs of our people that we serve. But we don't do it alone. We definitely cannot make changes alone. We need partners and collaboration. It is definitely a kako thing. Everyone working together for the greater good. So this is a picture of our governor, and here are our public health nurses. This is our new branch chief, Gloria Fernandez, and our fellow supervisors on Oahu. So May 10th, he proclaimed it to be School Nurse Day, and this is a collaboration of Department of Health, Public Health Nursing, Department of Education, and Hawaii Keiki Nurse. So in order to make changes, we definitely cannot do it alone. We have to collaborate in order to do something and to make things move. So definitely we partner with nonprofits, health centers, we go to the private sectors, we partner with different state agencies, county and federal agencies as well. So this is where I kind of take you on we're continuing on our journey, but this huaka'i is going to be leading you specifically to what we do as public health nurses here on the island of Molokai. As you see pictured, we have the picture that I chose this is the pua'ala. This is an endangered endemic plant of Molokai, and it is found on the sea cliffs, the tallest sea cliffs in the world, and that's on Molokai. It's I'm not sure even if they still, I know they're still critically endangered, but their natural pollinator is no longer. So humans needed to actually pollinate these flowers. So just like these flowers, like so are the lives of our kupuna who are not able to care for themselves. They're endangered. They depend on other people to come and help them. And I love this quote also. It's promoting health equity across the lifespan is important for every human being, no matter where you are or where you live. Unfortunately, not a lot of kupuna here don't ever know what health equity is because it's not existent here. We cannot just go and drive to get care. It is a difficult journey, and that's where we try to step in and change policies and look and continue to look at the upstream. What can we do upstream to help our kupuna to live safe and healthy and have the quality of life in the end? In 2022, we did have a healthcare crisis. So you see pictured is Dr. Emmett Aluli and Dr. Thomas. They both had passed in the same year. And now Dr. Aluli had served Molokai for over 40 years. And so he had generations of families as his patients. Dr. Thomas, when he came, he also came and he served our community. Like they really truly wanted to help the people here to get better and they were awesome doctors. They provided home visits, which it was so helpful for us here public health nursing because we had a lot of kupuna that didn't go to the doctors because they would have dementia. It would be hard for us to get them there. So they would come out to do home visits with us because that was their patients. Since their passing, like there was a exodus of medical providers after that. Like doctors were leaving. Like, they decided, okay, we're out. were gone. We had a longtime APRN that was working in the community. She retired not too long after. So we were really, really in a crisis in 2022, which was not too long ago. But since then, we're moving on to our Huakai. Since then, things were happening. So we started to, let me take you a little bit back. So in August of 2022, we at the Molokai Public Health Nursing started getting increased amount of calls from providers and community programs, community members, families to help kupuna as they were living alone and could no longer care for themselves. We decided to do something about it. Again, looking at the upstream. Most of them were displaced from their homes and placed in care homes or nursing facilities off island to receive care. We had a big dream of a care facility, a facility that could provide long-term care, skilled nursing services, intermediate care services, an emergency hold for mental health patients, a place where our special health needs children that are now adults could come during the day to provide respite for their families, and even respite for kupuna. We had a dream of this facility to provide jobs, be a training facility for healthcare occupations, and our kupuna could stay at home. Of course, our dream was huge. We needed to take it down a notch. I'm that kind of person that you go big or go home. Like, so why not go big? But we have to think realistically. So we focus on kupuna. We focus on a long-term care facility because we have no long-term care beds. We are the only island in the state of Hawaii with no long-term care beds currently, and I don't know how many years more. So we conducted a non-official survey. The reason why I said a non-official survey because we didn't go to our Department of Health um, protocols to go get it vetted. We just wanted to know for ourselves if our community wanted a long-term care facility because what we weren't going to fight and push for it if our community said no, because if our community doesn't want it, the people don't want it, then you know what, we're not gonna do it. But we did do a survey and it was a unanimous yes, we need something here for our kupuna. During a home visit with an 80-year-old kupuna taking care of her younger sister with Alzheimer's dementia, she said to me, wouldn't it be nice if Lunalilo Homes expanded to the outer islands? I told her, you know what, Auntie, that is a great idea. And that's how I met Dr. Poki Ibalas. Because at that time, she was the interim director of Lunalilo Homes. We also understood that we needed to get everybody on board. We personally went to Molokai General Hospital, Molokai Community Health Center, Napu'upai, Molokai Family Health Center, and all the programs and providers who serve kupuna to join together as one to work towards a long-term care facility. So we knew all our voices as one would make a greater impact. And now, the next big question, besides where the money was coming from, was who was going to work there? So this is around the same time when we were going through our healthcare crisis. During that time, we were pleading and begging doctors to come because we didn't have any, like there was that mass exodus after our two kaukas passed away. So we needed, at that point in time, we knew we needed to build our own healthcare worker capacity. Like, why were we begging for doctors to come? Why weren't we building up our own people to become doctors? So we reached out to UHMC's Molokai Learning Center to be a part of the discussion. Since meeting with Kelly Durua and Olelo Spencer, they have been our biggest advocates in providing classes and looking for funding resources to help to get health care kinds of classes here on Molokai. So currently they've finished 3 cohorts of CNA classes, a medical assistant cohort, and we're super excited for the LPN hybrid program coming in spring 2025. So that's what we actually wanted to do. Because as I said in the beginning, like I had to be relocated off island in order to obtain that degree. So did my co-workers. Anybody who has an RN degree or LPN degree, like we all have to relocate off island to get those degrees. But we wanted to grow our own. I didn't come back. Like I left and I came back like a whole lifetime later before I started serving again in this community. We just don't have time to wait for people to come back. We need to grow our own now. So they're super supportive. So as we met as a group monthly, we're able to, have John McDermott come speak to us. We're able to meet him. He was a wealth of knowledge. We had Justin Nam of the Office of Care Home Assurance come and speak to us. We reached out to our state representative, our senator, our mayor. We reached to everyone to get it in their ear that Molokai has no long-term care beds, and we're working on it, but we need their support. So the next big question is, besides where the money coming from, was who's going to run it. So we reached out to Lunalilo Homes, and that's when I had more discussions with Dr. Balaz. At first, at that time when Dr. Balaz was there, it was part of their strategic plan, but they were not looking to expand at that time. So we looked at other places. We thought about Halemakua because they are a nonprofit and they knew how to keep their long-term care facility on Maui. They knew how to keep it going. So we reached out to Westlaw. In fact, Judy Mikami reached out to Westlaw. He came to Molokai, attended our meeting, and we asked him if Halemakua could expand to Molokai. His answer was no. so it was like it was a blow to us. But Halemakua would help us by guiding us. We were like, okay, at least, they can help guide us. So majority of because a majority of our kupuna end up going to Halemakua anyway because there's no place here. So Halemakua, with the collaborating with them, they actually help fund a business assessment to be completed. So we're very grateful for that. So as time went on, like we're looking for other entities to take it over because we can't do it. We're Department of Health. We were not going to do it. We were not going to create a nonprofit to do this. Like there's no way because that takes time and we don't have time. So that's why we kept looking for other options out there. We looked at hospice, we went back and forth with Halemakua because, they had this money, they were doing the business assessment for us. And Kaunakakai, so there was a church here, the Kaunakakai Baptist Church. They actually are willing to donate a portion of their land and their buildings to provide an adult day help. Halemakua, Westlaw, and Tianaka Ho'ohanohano have been actively engaging in coming up with solutions for adult day health. And they actually are going to expand and provide that adult day health here on Molokai through at the Kaunakakai Baptist Church. So we're very grateful because that is one step below that long-term care facility of our big dream. So it took a lot of collaborating, a lot of talking, a lot of pleading, a lot of going back and forth with people. Like when we were told that no, we can't do it, and every time somebody said no, it kind of like put the drive down for not only us but the other people that was part of this group, which is all the community providers that provide services for kupuna. But then we will also continue to remember the why. It's our kupuna that died off island, not surrounded by family. Our kupuna that died in place, waiting to be placed. Is our kupuna and our even individuals that couldn't care for themselves, that needed to be relocated, missed out on their children's lives because there was no place for them to be cared for here on island. So that's why we continue to persevere even if all the doors was shutting on us. And when Halemakua agreed to do the adult day house, like, oh, yay! There's there's hope. There's hope. That's why we keep pushing. So continuing on our journey, this is our Molokai team. I am proud to say that we are all from Molokai. We grew up here, we live here, and we work in the community. So we understand the needs. And it hasn't been that way. Like in the past, nobody was from Molokai that actually worked here. They came here, they got married to people, but nobody actually was from here. So I'm very proud of our team now that we are all from here. And it's and even if like there's a whole mountain in front of us, we're still looking at that long-term care facility. We're still looking at it like, oh, it's a huge mountain. We can do it no matter what. And we just gotta look at the first step that we take instead of the mountain that is ahead of us. And I believe with our community partners and with the people that are helping us, even from off island, that you know this Olelo Noel is true. No task is too big when done together by all. And with the support of our community, that was our number one drive too. We do have the support of our community because they see they have kupuna themselves that they're taking care of, or they had kupuna that needed to be placed off island, or they had family members that needed to relocate because there was no care for them here. So I truly believe that if we all work together, like we can accomplish great things. But it is definitely a Kako thing, and that's what public health nurses do. We 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 strive to get we strive to see the trends in the communities, see what it is, and try to find solutions. This is only one part of our Kuleana, but this is what we're currently focused on. We have many needs in our community, but this is one thing that we could help start the process with. And I'm super stoked that things are moving. Let's see what's the next thing. So mahalo for being part of this journey with me. I hope with this journey that you have learned a lot. Maybe I went too much into detail with some things, but now you know. If you never know, now you know. We look forward with you will help to serve people. The next slide is actually our Oahu site. So I hope this Huakai provided you with a better insight of what public health nurses do. We have East Honolulu, West Honolulu, Central Oahu, Leeward Oahu, Waianae, and Windward sections. If you need to contact them, please contact and find out more information. Again, what I told you in the beginning in this presentation were basically what we do statewide, but I did have a more specific focus on what we do here in Maui County. Again, we do the same thing, it just looks different. Because with emergency preparedness, Big Island has always been active in that because they have the volcanoes, they have the fog, they have everything going on over there. Kauai, you have flooding, you have the rain, you have hurricanes. So they're actively involved in those things. So how we do things is different, but we all provide those services. So please feel free to, if you're on Oahu, please contact any of these our sections. They'll be more than happy to help. On the neighbor islands, we have East Hawaii and West Hawaii. We have our Maui County PHN section, Lanai office, Molokai office, and the bottom is our Kauai PHN section. Again, we are more than happy to help where we can. If you have questions about, I wonder if you can help me with this person, please don't hesitate to call. They can either tell yes or no. But you gotta ask. That's the only thing, you gotta ask. So please feel free to reach out to any of these sections if you think that they could help you or the people that you serve, or if you need help yourself. And any questions?
I have a question, Courtney.
Sure.
Where do you get most of your referrals? Is it from community folks in the community, or?
We get them from the providers in our community, the doctor's offices. We do have community members. Like it's a mixture, individual family members, or just community, because sometimes we have kupuna walking on the side of the road. And so they're calling concerned about that. So it's everybody. We even get referrals from APS because it's not at the point where they can step in, but it's is right below the point where they can step in, but they still want somebody to be at least checking up on the kupuna. So it's
Right.
very, it's not only specific people or entities, it's everybody. Or basically for here on Molokai and on Maui also, they go through the same thing. So we, like again, although we like to help everybody, we we cannot. So if there are services or resources that already provide the services that can help kupuna, then we would definitely refer them there first. And then if they cannot, then we are there. We will go. There's no doubt about it. So yeah. So yeah, it's a different mixture of people who refer.
Yeah. Yeah. I find that we have on Oahu, uh, I think the default is call APS. And I don't know that an APS can be frustrating to deal with because they have certain uh, requirements they have to meet before they will even investigate and take the case on. So
Yes.
knowing that we can refer to public health, to the public health nurses, and have them check it out would probably be a better first approach rather than APS. Unless, of course, we know or suspect there is elder abuse or financial
Right.
exploitation.
Yes, definitely. That's the automatic APS. But the reason why
Yeah.
APS also refers to us on Molokai is because we don't have an APS worker. And so
Yes.
we have reached out to the Department of Human Services, and they are now looking at a hybrid position, CWS, APS position. They have their position on Lanai, so now they're gonna um, try and duplicate that same position here on island, and that's gonna be presented to next year during legislation, because it does
Oh,
take an act of Congress to reopen up
right.
reopen
Yes. And
up the
funding and
positions in the state. Yeah.
yeah, yeah. I think that's something we would all support um, because you folks, it isn't your mission to root out the elder abuse and the financial exploitation.
Right.
And APS, if there is someone who can represent APS, even if they are referring it to Honolulu or Maui, at least there should be somebody to respond to that.
Yes. So we work very closely with them because they are not able to get a flight out the same day, and if they're really in a tight bind and they really suspect something, is that you call 911. Don't even like we'll call 911, but if you guys really suspect, call 911. Like that's the best case
Yeah,
scenario. Like just call 911. So we
right.
go out to just do spot checks for them, just to and again, a lot of the times it's because they can't really do anything because they're not at that referral level where they can actually respond to what was brought in by intake. So that's how come they
Yeah.
reach out. And then like
Mhm.
sometimes we can't do anything either because they won't let us in either. Because everybody has
Yeah.
rights and we have to respect their rights, even if they're everybody knows that they need help. We cannot. We have to respect what their rights are. Mhm.
Yeah. The hard part. Yeah. Well, that was a really great presentation. Yeah, I did learn a lot. And
I'm
I've
glad.
had, yeah, I have had a few instances where I've worked with public health nurses in the past. Actually had a client whose niece was a public health nurse. So I knew a little, but I didn't realize quite the reach that you have. And considering you've got the whole island of Molokai and there's only 5 people in your office, that you
But
must be
the
awfully busy.
well, that's why like when you work and live in the community that you serve, like work is never done because they'll see you in the store. They'll
Right,
see you at
right.
the
Yeah.
our kids'
You're
game.
never off. You're never off
Yeah,
duty.
they'll stop you in the middle of walking across the street. But you know what? We love it. We love it. That's why we do it. And it's and it is to help our community. Like because we don't have the same types of services and afforded the same types of services. Like we really need to couple and work together to provide what we have with what we people need. So
Yes,
yeah.
yes,
So yeah.
fantastic.
Well, thank you guys. I'm glad you enjoyed it.
Yeah, yeah, it was terrific. Yes, I see Sherry clapping.
And
I
I
think
hope
we will
everybody
put
is signing up to go to Dorothy Kobe's
fundraiser.
presentation for
Yes,
our yes, you know,
yes,
that's my
yes.
push. Because she came to
That's gonna.
Molokai, we love her.
Oh, we love her
Yes,
too. Yeah,
yeah,
yeah. She's unique and very, very special what she does, and
yes,
she's a tremendous person to be the honoree for us this year. So
yes,
yeah, we want everybody to take a take an evening to join us in
yes.
honoring her, and just to be together and have a chance to
A
see
lot
one
of the
another.
a lot of the caregivers that attended her presentation here in Molokai, they're so appreciative. They continue to be appreciative of what they've learned. So yes, like
Yeah.
I am flying down for that.
Yes,
So that
yay.
yes. So I encourage everybody to be there
Yes,
and like she's awesome. Yes.
yep. Well, we are just at 12:30, so thank you all so much for attending. I'm going to just take a look here at my list. Our next general membership meeting is September 19th. And if anybody, we'll be announcing the speaker in the coming months, and it'll be in the newsletter. But I just want to say to those of you, Tani and Lauren and Francis, that if you have any topics or speakers you'd like to hear from, please get in touch with us, get in touch with me, get in touch with Sherry, any of us. And we'd certainly love to talk about it and consider it. We just want to make sure that we get good information out to the community and we respond to the things that people want to hear about. So thank you for taking the time to be with us. Thank you, Courtney, for putting the work into putting that presentation together. And we will see you next time.
Mahalo, hui
Bye
hou.
now. Bye.